When we talked before, you indicated that really kind of from your head on down, there are places where you're really having significant pain. Can you address that?
Sure. From the top of my head, the pain just doesn't seem to stop. The temples, sometimes behind my left eye, often behind my left eye, the jaws.
Are you feeling pain there now?
Yes.
Okay. Let's try to go over the places right this moment where you're feeling pain and try to make it objective in some way. So point to the spot, just pick a place in your head and that's the worst and point to it.
So today I would say behind my eye.
Okay.
Today.
And on a level of 1 to 10, with 10 being the worst pain you could possibly imagine, 1 being just barely noticeable, what number would you put on that?
Today it's not as bad as it typically is, so today I would probably say it's like a 5.
But it can get much worse than that.
Oh, it usually is much worse.
And it goes up to
12.
beyond
10,
imaginable
yes,
then.
yes.
Yeah, okay.
Completely debilitating.
Okay. So that's your worst pain. Where's your next worst pain?
Probably my shoulders.
Right now? Mm-hmm. And the level of pain, if you would put a number on that?
I would go higher with that. I would say, probably 6.5.
All right. Now I want you to turn your head as far that way as you can go. Does that hurt?
It's okay.
And now the other way.
It's definitely tighter.
Okay, so you can't go as far. Okay. The back of your neck right now, is that?
Yes.
What would you know? What number would you put on the back of your neck?
Today would probably be like a 4.5, maybe.
Okay. So not. That's a lot of discomfort, but
yes.
But you've learned to live with that.
Yes. I've taken lots and lots of Advil.
Did you take some today?
I did not today, but in my trying to learn to live with the pain.
Are you feeling any tightness in your throat right now? Or your chest?
My chest, yes.
Point to right in there.
Yeah.
Have you put your finger in this pulse oximetry device, and we'll see what your oxygen level is right now. The baseline oxygen level right now is bouncing back and forth between 93 and 94. How do you feel about your breathing right now? If you were just to become aware of your breathing, is there any comment you can make about it?
I often forget to breathe or don't seem like I'm not breathing right. With the other physical therapy that I'm doing, I am focusing on that.
So intellectually, you're trying to focus on it. You're trying to
Yes.
just make a mental note.
Right.
To continue to breathe.
Right.
But then you notice sometimes that you actually forget.
Absolutely.
Or you're breathing very shallow.
Yes.
Okay. Okay. Now turn your head all the way to the left. And now all the way to the right. How long has this been in your mouth?
Less than a minute, maybe a minute.
I'm guessing maybe 2 or 3.
Okay, 2 or 3 minutes. Okay.
But who's counting? But you're noticing a change.
Absolutely.
I want you to just go to your head and neck and shoulders and see if there's any.
Oh yeah. I can turn it more. How does that do that?
I'm tempted to say smoke and mirrors, but really it's just taking advantage of your body's physiology. There is a swallow reflex. Your tongue is intimately associated with your epiglottis. You've had some difficulty swallowing things in the past. Can you talk about that a little bit?
It takes effort to swallow and make sure that I swallow it all. And I really have to think about it. And sometimes I can't swallow things, and
Okay. Your difficulty in swallowing has caused your body to be on hyper alert. Because if you swallow incorrectly, you're either going to choke or drown. So the body in its infinite wisdom is coping. It's causing your muscles in the head and neck area to be on hyper alert. And in just this short period of time with this orthotic in your mouth, things are starting to say, okay, I can chill, I can relax a little bit here. Now, we've got a lot of adjustment to do. We've just barely started this process. But your body's taking advantage of the fact that it can swallow comfortably, and it's starting to ease off.
I can feel the difference.
Try to clarify that more. When you say you can feel
Well,
the-
even when you asked me earlier about the tightness, I mean, I can just feel like there's a huge opening, with my air passage in my neck. It just feels more free and less tense and not strained.
Now, I want you to talk to me about your breathing.
Well, my breathing seems to be much more relaxed. It seems to be more natural. I don't have to think about it. And it seems to have like its own normal rhythm, where before I would find myself holding my breath or not breathing, or, much more tense and stricter air passage, it seemed, or tighter, tenser.
It felt tight in your throat?
There, yes. And I didn't realize how tight it was until I had this in and felt what a relief it was. So
And that feeling of relief came again pretty quickly, didn't it?
it came in, yes, right away. As soon as you put it in, it was shocking. With the breathing, I feel like I can breathe out of my nose better, right, and more naturally. And it's just, all the air is just flowing effortlessly.
Did your nose feel congested before?
I don't think it felt congested, but I felt like I was breathing out of my mouth too much, and like I would be conscious of it. I'd have my mouth open all the time, and now I feel like I can breathe with my nose, through my nose, with my mouth closed, and it would just be effortless.
Okay. So the bottom line is it's easier to breathe through your nose now than it was before we started this process.
Absolutely, yes.
Your oxygen levels have gone up. When we started, they were bouncing back and forth between 93 and 94, and now they're bouncing back and forth between 95 and right at this moment 97, 96. We started this appointment about an hour and a half ago, and I think it's an appropriate time for you to recap from your perspective how you are feeling now compared to how you felt when we started.
Well, everything is different, actually. When I came in this morning, I had pain from my head, down my jaw, behind my eye, my neck, shoulders, and unbeknownst to me, my breathing, I guess, was different also. But since I put in the appliance, I can feel relief from the pain. All the pain has been relieved. I have more freedom in my neck, the turning left to right with my neck. My breathing is much smoother. I didn't know that it was difficult before, and also the swallowing has improved also with the appliance. So again, I didn't realize that I was having, or that my swallowing was, laborious before, but now it flows so much more smoother, and it's just a really nice transition. It's actually a relief, and for some of the things I didn't even realize I was having problems with. So.